So when we talk about life-limiting disease, typically that's going to mean that there's a major system, right? One of our major life-sustaining systems is somehow not doing what we want it to be doing. And those life-sustaining systems are the heart, the lungs, the liver, the kidney, and the brain. And so when we think about people, getting to the point to where they're looking like they could be more hospice appropriate, that their lifespan may be limited to 6 months or less, it's usually because one of those organ systems, or maybe more than one, are really starting to not function in a way that is going to have a lot of reserve to continue on for too much longer. So the most common maybe diagnoses we will see are things like heart failure, congestive heart failure, COPD, of course liver failure, kidney disease, chronic kidney or acute kidney failure, Alzheimer's, Lewy body dementia, Parkinson's disease. Those are probably some of the major ones from each of those systems that I think we see the most of. Additionally, another big one that doesn't necessarily fall into one of the big 5 organ systems, it kind of sits all on its own, is cancer, of course. And cancer, especially when it is metastatic, that would be another primary diagnosis that we would see a lot of. Is a lot of times, if the cancer's limited to one organ, there's a lot more treatment options. But once that cancer is spread to more than one organ, a lot of times those treatment options really start to become less available to patients. And we may see, as the cancer progresses, it starts to affect one of these other major organ systems to the point where it kind of overloads the heart, kidney, liver, lungs, brain. So I would say, as a general rule, those are the main diagnoses we see serving on hospice and palliative care.